Hi everybody, today I am going to discuss an important illness about eye, and that is blepharitis, which is inflammation of the eyelids. Blepharitis usually affects both eyes along the edges of the eyelids. Blepharitis commonly occurs when tiny eye glands near the base of the eyelashes become clogged, causing irritation and redness. Several diseases and conditions can cause blepharitis. Blepharitis is often a chronic condition that is difficult to treat. Blepharitis can be uncomfortable and unsightly, but it usually doesn't cause permanent damage to your eyesight, and it is not contagious. Now let me tell you the symptoms. Blepharitis signs and symptoms are typically worse in the morning. They include watery eyes, red eyes, a gritty burning or stinging sensation in the eyes, eyelids that appear greasy, itchy eyelids, red swollen eyelids, flaking of the skin around the eyes, crusted eyelashes, eyelid sticking, more frequent blinking, sensitivity to light, blurred vision that usually improves with blinking. If you have blepharitis signs and symptoms that don't seem to improve despite good hygiene, regular cleaning and care of the affected area, and despite these good hygiene measures, if it is not relieved, then you should see the doctor. Now let me tell you the causes of blepharitis. The exact cause of blepharitis is not clear. In some cases, it can spread to another person. It might be associated with some other illnesses, which I am going to tell you. And the first illness in which there is a link of blepharitis is that this seborrheic dermatitis, which is dandruff of the scalp and eyebrows. Then blepharitis can be due to some infection. Okay. It can be due to clogged or malfunctioning oil glands in your eyelids. There is a condition known as rosacea. I have already made a video about rosacea that can be also associated with blepharitis. This rosacea is a skin condition characterized by facial redness. Then there are some allergies, including allergic reaction to eye medications, contact lens solutions, or eye makeup that can also cause blepharitis. Eyelash mites or lice also can be responsible for blepharitis in some cases. Then if you have too much dry eyes, then it can also cause blepharitis. Now let me tell you the complications of blepharitis. If you have blepharitis, you might also have eyelash problem. That is one of the complications. This blepharitis can cause your eyelashes to fall out, or the eyelashes can grow abnormally, which are misdirected eyelashes, or they can lose color. Then there is a complication of eyelid skin problems. Scarring can develop on your eyelid from long-standing blepharitis, or the eyelid edges might turn inward or outward. Another complication is excessive tearing or dry eyes. It can either excessive tearing or dry eyes. This can occur. Abnormal eyelid secretion and other debris shed from the eyelid, such as flaking associated with dandruff, can build up in your tear film. The tear film is made of water, oil, and mucus solution that forms tear. So these debris of blepharitis can mix with these tears, which can cause excessive tearing. Okay, or also it can cause dry eyes. Abnormal tear film interferes with keeping your eyelids moist. This can irritate your eyes and cause symptoms of dry eyes or excessive tearing. And then another complication is stye, which is an infection that develops near the base of the eyelashes. The result is a painful lump on the edge of your eyelid. Stye is usually most visible on the surface of the eyelid. Another complication is chalazion. A chalazion occurs when there is a blockage in one of the small eye glands at the margin of the eyelid, just behind the eyelashes. This blockage causes inflammation of the gland, which makes the eyelid swell and redden. This can clear up or turn into a hard, non-tender bump. Another complication is chronic pink eye. Blepharitis can lead to recurrent bouts of the pink eye, which is known as conjunctivitis. Well, on my channel with BB, there is a video about conjunctivitis, which you should see to know the difference between blepharitis and conjunctivitis. Then there could be injury to the cornea. Constant irritation from inflamed eyelids or misdirected eyelashes can cause a sore to develop on your cornea. Not having enough tears could increase your risk of a corneal infection. Okay, these were the complications of blepharitis. Now let me tell you the diagnosis of blepharitis. How we diagnose this condition. When the patients come to us, then we take history and examine the eyes so we can come to know about this illness. We can also use a special magnifying instrument to examine your eyelids and your eyes, and that will be give a more clear diagnosis. Also, in some cases, we might use a swab to collect a sample of the oil or crust that forms on your eyelid. This sample can be analyzed for bacteria, fungi, or evidence of an allergy. So these are the diagnostic methods. Now let me tell you the treatment. Self-care measures such as washing your eyes. Self-care measures such as washing your eyes and using warm compresses might be all that is needed for most cases of blepharitis. If self-care measures are not enough, your doctor might suggest prescription treatments which include medication that fight infection. Antibiotics applied to the eyelid have been shown to provide relief of symptoms and resolve bacterial infection of the eyelids. These are available in several forms including eye drops, creams, and ointments. If you do not respond to topical antibiotics, your doctor might suggest an oral antibiotic. Then there are medications to control inflammation. Steroid eye drops or ointments are used for this, generally only for people who do not respond to other therapies which I have mentioned before. Your doctor might prescribe both antibiotic and anti-inflammatory drugs. In some cases, we might prescribe antibiotic and this steroid creams or ointment together. Okay. Then there is the option of medication that affect the immune system. Topical cyclosporin, which comes with the name of Restasis, has been shown to offer relief of some signs and symptoms of blepharitis. Then we need to treat the underlying condition. As I told you, the blepharitis can be caused by other illnesses such as seborrheic dermatitis, rosacea, or other diseases. So by treatment of these diseases, blepharitis can be controlled. Other treatment options such as using intense pulse light might unclog the glands. More study is needed regarding this pulse light therapy. Okay. Blepharitis rarely disappears completely. Even with successful treatment, the condition frequently is chronic and requires daily attention with eyelid scrubs. If you don't respond to treatment, or if you have also lost eyelashes or only one eye is affected, the condition could be caused by a localized eyelid cancer. So you should be careful about this. Now let me tell you some lifestyle and home remedies. Self-care measures might be the only treatment needed for most cases of blepharitis. You should clean your eyes daily. If you have blepharitis, you should follow the self-care remedy 2 to 4 times a day during flare-ups and twice a day after the condition is under control. Apply a warm compress over your closed eye for a few minutes to loosen the crusty deposits on your eyelids. Firmly but gently massage the eyelids using a clean washcloth or a clean finger. Immediately use a clean washcloth or cotton-tipped applicator moistened with warm water and a few drops of diluted baby shampoo or an over-the-counter eyelid cleanser to wash away eyelid debris or scales at the base of your eyelashes. Use a different clean cloth for each eye. In some cases, you might need to be more deliberate about cleaning the edge of your eyelids and your eyelashes. To do this, gently pull your eyelid away from your eye and use the washcloth to gently rub the base of the lashes. This helps avoid damaging your cornea with a washcloth. You should ask your doctor whether you should use a topical antibiotic ointment after cleaning your eyelids in this way. Rinse your eyelids with warm water and gently pat them dry with a clean, dry towel. It might help to stop using eye makeup when your eyelids are inflamed. Makeup can make it harder to keep your eyelids clean and free of debris. Also, it is possible that makeup could reintroduce bacteria to the area or cause an allergic reaction. You can also lubricate your eyes. Try over-the-counter artificial tears. These eye drops can help relieve dry eyes. You should also control dandruff and mites. If you have dandruff that is contributing to your blepharitis, ask your doctor to recommend a dandruff shampoo. Using a dandruff shampoo might relieve your blepharitis signs and symptoms. Using tea tree oil shampoo on your eyelids daily might help deal with mites. Or try gently scrubbing your lids once a week with 50% tea tree oil, which is available over the counter. You should contact your doctor if you don't see improvement in 6 weeks. And stop using tea tree oil if it irritates your skin or eyes. Now let me tell you some alternative medicine. No alternative medicine treatments have been proved to ease the symptoms of blepharitis. However, a diet rich in omega-3 fatty acids or supplements containing omega-3 fatty acids might help blepharitis associated with rosacea. Omega-3 fatty acids are found in foods such as salmon, tuna, trout, flaxseed, and walnuts. More study is needed. Well, I hope you'll like this video of mine about blepharitis. Till now, if you haven't subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think that my videos provide some sort of benefit, even it is a little bit benefit, please give a thumbs up to this video, and that will give me encouragement to make more useful videos on health related topics. Okay, and please do not forget to share my videos, because this channel with BB is basically meant to help humanity across the world. So by sharing this video, you can also contribute to this great initiative by helping humanity. Thank you so much for watching this video. See you in next video. Bye for now.